Hi, I'm Susan Taylor with Scripps Health in San Diego, California. William Shakespeare once wrote that the eyes are the window to your soul. Here to talk about keeping your eyes healthy is Dr. Quan. She's an ophthalmologist with the Scripps Clinic Medical Group. She specializes in glaucoma and cataract surgery. Thanks so much for being with us, doctor.
Thanks for having me, Susan.
So what are the most common eye problems?
To go over the most common eye problems, I'm going to show you the model of the eye. And so you can see here, this is the model of the eye head on. And you can see here that this is the front part, which is the cornea. And then behind that, we have a lens. And over time, the natural lens is going to opacify and turn yellow like this. And this is known as a cataract. A cataract is one of the most common causes of vision loss. And if we go into the back of the eye, many people have diabetes. And sometimes the blood sugar can get into the back part of the eye, into the blood vessels, and you can get what's called diabetic retinopathy. In addition, we all have a drainage system that helps to lower the pressure in the eye. And as you get a little bit older, the drainage system may not work as well and the fluid builds up and you can get a condition called glaucoma, which affects the optic nerve in the back of the eye. So the three most common causes of vision loss include cataracts, diabetic retinopathy, and also glaucoma.
We'll talk about those in just a minute, but what causes dry eyes, red eyes, itchy eyes?
One of the most common causes of these conditions is eyelid inflammation known as blepharitis. And as you get a little bit older and in sunlight, the eyelids can get inflamed and the oil glands along the eyelid margins can get clogged. And so when the eyelid oil glands get clogged, not enough oils go to the surface of the eye and your tears evaporate much quicker. And this causes extremely dry eyes, itchy eyes, and eye redness.
And what about screen time? Too much time on the computer or too much time, on the cell phone?
That's a great question. As you're on the TV, on the computer, on your phone, your eyes are wide open, not really blinking very much. And that's also going to cause a little bit of dry eye. And so you notice by the end of the day, you've been on the screen all day, your eyes are going to feel extremely dry.
So should you be taking breaks from the computer and the cell phone and blinking your eyes more frequently?
Yeah, and other things that you can do is use preservative-free over-the-counter artificial tears as a supplement, maybe 3 to 4 times daily.
Who is most at risk for these dry eyes, itchy eyes, red eyes?
Elderly patients are at most risk for these types of conditions because as you get a little bit older, in addition to your eye oil glands getting clogged, you also don't produce as many tears.
Are there things that you can do to prevent these conditions?
One thing that you can also do is twice a day in the morning and at nighttime, you can take a hot, warm face towel when you're washing your face and kind of just rub it along your eyelid margins for a couple of minutes. And this will naturally give your eyelids a facial and open up those oil glands and allow the oils to drain to the surface of your eye to lubricate your eyes.
Talk about glaucoma. What is it and who's most at risk?
That's a great question. Glaucoma is a multifactorial condition in which there's damage to your optic nerve that leads to peripheral visual field loss. And patients who are most at risk for developing glaucoma include aging, getting older, having a family history of glaucoma, and also elevated intraocular pressure.
And what are the symptoms and treatment?
So the symptoms of glaucoma, which is damage to the optic nerve in the back of the eye, first starts with peripheral visual field loss. And so right over here, you may not notice your peripheral visual field loss. And early on in the condition, you may not even notice it. And so it's so important for you to come into the eye clinic and get a test called a Humphrey visual field test, which allows us to determine how much peripheral visual field loss has been lost. And if left untreated with elevated intraocular pressure, you may slowly lose all of your central visual acuity.
So what's the treatment of glaucoma?
So the treatment of glaucoma involves topical eye drops, laser therapy, oral medication, and glaucoma incisional surgery. And so the treatment of every single patient is very unique to the patient, and it's multifactorial, can be a combination of all of the above.
And if you need surgery to treat the glaucoma, what's the recovery time for that?
So the recovery time for glaucoma surgery is extremely dependent on the type of surgery that you get. And so if I perform a minimally invasive glaucoma surgery, such as a glaucoma stent or a surgery in the angle, then the recovery time is really only about a week or so. But if you have severe glaucoma and I'm doing incisional glaucoma surgery that involves opening the eye or creating a drainage system or a tube, then that takes about a couple weeks to a couple months.
And talk about cataracts. What is it and who's most at risk?
So this is the model of the eye again, and I just want to show you, as we are born here, we have a natural lens that is extremely clear. And as you get older, what can happen is this lens here can opacify and turn yellow, and this is considered a cataract. Cataracts are going to cause you to have blurry vision, hazy, things may be more hazy and yellow, and especially at nighttime when your eyes are dilated and you're driving, you're going to get glare from the oncoming lights and not be able to see as well. And so cataract surgery involves taking out the cataract itself and then putting in a clear lens that allows you to see. And cataract surgeries are performed typically one eye at a time, and it takes about 10 to 20 minutes. The recovery is about 1 week, and we typically do one eye maybe 1 or 2 weeks apart, and the patients are extremely happy. Nowadays, there's a standard lens that allows you to see extremely well at distance, but with new technology, there's what's called premium multifocal lenses that allow you to be spectacle independent, seeing very up close, intermediate, and even far away. And these patients are extremely happy.
So you won't need glasses after you have the cataract surgery?
Yes. In most patients who get the multifocal premium lenses don't need any glasses after cataract surgery.
That's good. So how often should you get your eyes checked to keep them healthy, and starting at what age?
So patients with no ocular symptoms, I totally recommend getting a comprehensive eye exam by either an optometrist or an ophthalmologist at the age of 40 years old. After the comprehensive eye exam, your doctor will tell you how often you need to follow up. Patients with a family history of eye conditions may need to be followed up yearly after that, but patients with no ocular symptoms maybe you need to follow up every 2 to 3 years. But definitely when you reach the age of 65 years old and you haven't had an eye exam yet, you may want to go get checked for cataracts, glaucoma, and diabetic retinopathy.
Any final thoughts, doctor?
If you're having any red, itchy eyes, foreign body sensation in your eyes, or on the computer all day, it's okay to take a break, put in some preservative-free artificial tears and come get your eyes checked with us, definitely by the age of 40 years old, and you can prevent some serious conditions from happening in the eye.
Dr. Quan, thanks so much for being with us. We appreciate you taking the time.
Thanks for having me.
If you want more information about glaucoma, cataracts, and how to keep your eyes healthy, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.